Hi there, this is Lori Edge-Hughes, and this is your 4-Leg Rehab Minute. And in today's minute, I want to talk about Librela. In Australia, it is Baranza. In cats, Solensia, and the pharmaceutical name is Bedinvetmab. Anyways, it is the hot new drug. It's been in England for likely 5 years because it's been in Canada for a year. It's new to the US. I have heard that it's going to be new in South Africa. If it's not, it's more recent in Australia, and I don't know where else. So I want to talk about this because this week I have talked to clients out of going back for their second shot because both of them were dogs, then one that had no joint arthritis, but was a Dachshund that had had IVDD in the past and was like, she's just old. She's got good little joints, right? But she's just old and she's got other weird stuff going on. And it's like, she doesn't have arthritis. Don't give it to her. And the other one was a post-op TPLO who it's like it's a new injury. It doesn't have arthritis. Don't give it this drug. Plus, it's a middle-aged dog. It's not even an old dog. So let's talk about this. I'm going to start off with saying Librela should be a last resort drug only. So the thing with Librela is it works as an anti-nerve growth factor. That's how it works. So the joint has pain. If we don't allow the joint to feel pain, we inhibit the nerve from signaling, then it can't feel pain. Alrighty, sounds great. Except nerve growth factor is important for a lot of other things that use nerves to function, like your spinal cord, and like all the nerve roots that supply all your muscles, and like the somatic nerves that supply your organs. Kind of important other things. So where am I at with that? I have notes. Okay, so when our local veterinarian started to use it because it was new, it was interesting, they wanted to try it, it was so exciting, we started to see dogs having sudden neurologic decline. I had some that became incontinent, bowel and or bladder. I had some with increased panting. I had one that developed organ failure, kidney failure, and before you say that happens in old dogs, I will say Zoidus is paying for those medical bills, including the euthanasia of that dog. So early on, we had lots of red flags about this, and because of my first patient that had to be euthanized because of this adverse event, I ended up speaking to the Zoidus pharmacovigilance veterinarian for Canada, and he wanted to know what I was seeing with the cases that we had at my clinic. And I explained to him that most of these adverse effects, and most of them were sudden neurologic decline or paralysis, and they all had a very similar feature in that they were they were senior dogs, geriatric, but they had mild neurologic signs to begin with. They were mildly neurologic, lumbosacral disc disease, likely degenerative discs, those sorts of things. And his response was, well, it's not supposed to be used in dogs with signs of any neurologic signs. And I said, all of these clients were told that there were no side effects to this drug. It was a wonder drug. It was magical. And I said, and I've talked to veterinarians, and they have said they were not told of that as being a contraindication or a do not use in those cases. And he said, well, it's not supposed to be used. And I said, you need to tell your salespeople that, because the sales pitch is getting out there that it's magical. It's magical. Now, I have also seen on some other groups. Now, there are lots of Facebook groups that if you want your eyes wide open, you can join 1, 2, 3, 4, or 5 of them. So there is Librela Reviews and Feedback, Librela The Truth, Librela Experiences, and there's one that's created by a vet Lessons on Librela. And here's a more recent fun one for you, Librela Class Action and Support Group, which should tell you something right there, because I have never seen anything like this for any other drug pop up. So let's say, so this is, okay. One of the other things then that I haven't necessarily seen myself, but people have been able to show this on some of these groups, is sudden, or not sudden, but let's say rapid degeneration of the joints itself, the arthritic joint itself, to the point that somebody had posted a 4-month before and after, and like this hip joint has just deteriorated that you couldn't think it was possible to deteriorate that much in 4 months, but it did. So I think the only thing further is, one other thing. Always one other thing. One other thing. The best, if you want to look it up, and you can look at those Facebook groups, likely the best blog out there is the one done by Dr. Daryl Millis. And if you were to Google My Lame Dog Librela, it'll pop up and you can click on that. And that's likely the best blog out there that explains it all if you want to look, and it's well referenced and it has all of this in it. So everything I wanted to tell you on my little sticky notes. I have some topics in FourLeg about this, and I have some other things that I have posted about this where I've kind of, danced around the bush and said, nerve growth factor is perhaps important, and or perhaps if you have a case where you want to increase nerve growth factor, here's how you do it. This 4-Leg Rehab Minute is to be a little more outspoken, to say this drug should be a last resort only in a senior geriatric dog when everything else has been tried, and there are no other neurologic signs, and you can be bloody well sure of that, then maybe you could give it a try. But otherwise, please don't. Okay, until next time, cheers.